Usage of contraceptive methods has been increased throughout the world, but there are millions of people who are using them in incorrect ways. You should know how to use these methods, advantages, disadvantages, and side effects of each method before you use them. Only then you can choose the one that is most suitable for you either for short-term or long-term usage. Today, I will try to cover the things you must know before using some contraceptive methods. The methods not included in this post will be presented next week, so stay tuned. Before we get into this topic, be sure to hit the subscribe button if you're new here because we will be uploading health and fitness tips weekly. And hit the bell icon so that you won't miss these helpful tips. Number 1. Intrauterine device. It is a small plastic device that is inserted into the uterus by experienced doctors. It has advantages such as it is effective and long-lasting for up to 5 to 10 years. It does not interfere with sex and breastfeeding. No need to remind yourself for taking pills daily or taking injection monthly. It can be removed if there are any adverse effects. Conception follows quickly after removal of intrauterine device. But it has disadvantages such as it does not protect sexually transmitted diseases like HIV, AIDS, herpes. It is not suitable for women with multiple sexual partners or whose partner has other sexual partners. It is not suitable for women with other medical diseases and gynecological problems. It has a risk of expulsion from the uterus due to heavy menstrual flow. It also has a risk of ectopic pregnancy. It also has some side effects. Due to unskillful insertion of the device, it has the risk of uterine perforation, prolonged and heavy menstrual bleeding, irregular menstruation, cramps and pain in the first few months. It also has a risk of infection. Number 2. Condoms. It is important to check for any tear before and after using it. It has advantages such as it is easy to use or carry. It is cheap and easily available. It is disposable. It can protect you against cervical cancer in women. It can also protect against sexually transmitted diseases. It has no common side effects, but it has some disadvantages such as it may slip or may be torn during using it. It can give you inadequate sexual pleasure. It needs to withdraw immediately after intercourse. It is not suitable for people with latest allergy. Number 3. Combined contraceptive pills (COC). You can start taking pill any day if you are sure that you are not pregnant. It should be taken 1 pill per day at the same time in order as shown in packing. If menstruation starts more than 5 days before taking pills, you should use a backup method like avoiding sex or use condoms for 7 days after taking the first pills. It has advantages such as it is effective and easy to use, regular menstruation with less cramping, reduced premenstrual syndromes. It can postpone menstruation. It reduces the risk of cancer in the female reproductive system, example ovarian cancer, endometrial cancer. It is also useful in the treatment of acne. It does not interfere with sex. You can become pregnant without delay after stopping the pills. But it has disadvantages and side effects. Headache, vomiting, breast tenderness, and mood swings as temporary side effects. It does not protect against sexually transmitted diseases. Spotting or bleeding for a few days during your menstrual cycle can be occurred. It can increase blood pressure. It can increase risk of breast cancer and clotting of blood in the blood vessels as serious medical problems. Here I answer a very common question that most women ask about these contraceptive pills. It is that, what if you mix taking the pills? If you miss pills for 1 or 2 days, you should take the most recent missed pills as soon as you remember and continue taking the remaining pill daily at your usual time. If you miss pills for 3 or more days, it has exceptions. If missed pills were on the first row of packing, day 1 to day 7, you should take the most recent missed pills as soon as you remember and continue taking pills as usual time, but you must use condom and emergency contraceptive pills for backup method. If missed pills were on second row, like day 8 to day 14, you should take the most recent missed pill and continue taking pills. If you miss pills during day 15 to 21, you should take the most recent missed pill, take the rest for today, then skip the last row and start a new pack. If you are confused about how to take the missed pills, you should consult with your doctors. Number 4. Emergency contraceptive pills. You can take 2 tablets of 0.75 mg levonorgestrel, one on each day, for 2 days at the same time, or you can take both tablets simultaneously. It has advantages such as it can be used after unprotected sex, used in case of sexual assault, used in condom rupture or split, used in late for depot injection, used if COC pills miss for 3 or more days, used if intrauterine device come out of its place, used when the couple failed to use other contraceptive methods during fertile days, used when the man failed to withdraw before he ejaculated. It has disadvantages and side effects though. These include it is not suitable for long-term usage, nausea, dizziness, vomiting, abdominal pain, slight irregular bleeding for 1 to 2 days after taking pills, early or late menstruation. So, these are the things you should know before using these contraceptive methods. The methods not included in this post will be in next week's post, so be sure to subscribe to our channel. Are you planning to use contraceptive methods in the near future? Or are you using one now? Are you satisfied with the one you're using? Leave a comment about your thoughts about these contraceptive methods. Thank you for watching the video until the end. If you want me to cover any other health-related topics, feel free to ask me in the comments below or directly through my email. Peace out.